You spend about 1/3 of your life asleep, and yet, most of us don't think twice about how we position our bodies during this vital recovery time. While sleeping feels like a passive act, your body is hard at work repairing cells, processing memories, and preparing you for the day ahead. The wrong sleeping position, however, can interfere with these processes, leaving you feeling exhausted and in pain. Today, we're breaking down 2 of the worst sleeping positions you must avoid and why they're so harmful. Why sleeping positions matter. Before diving into the details, let's understand why your sleeping position is such a big deal. The way you sleep directly impacts your spinal alignment, muscle tension, circulation, and even your breathing patterns. A poor sleeping position can cause chronic issues like back pain, neck stiffness, headaches, and even digestive problems. Imagine spending 8 hours every night in a position that strains your body. Over time, this repeated stress can lead to long-term damage, making it essential to identify and correct bad habits. The stomach sleeper dilemma. Let's start with stomach sleeping, one of the most common yet harmful sleeping positions. While it might feel comfortable initially, it's a nightmare for your spine and neck. When you lie on your stomach, your lower back is forced into an unnatural arch, putting immense pressure on your lumbar spine. This can cause chronic lower back pain and stiffness that doesn't go away with stretching or exercise. But it doesn't stop there. To breathe while sleeping on your stomach, you have to turn your head to one side, which twists your neck unnaturally. Over time, this can lead to neck pain, stiffness, and even herniated discs. Research from the American Chiropractic Association shows that stomach sleeping reduces natural spinal alignment by up to 60%, significantly increasing the risk of musculoskeletal issues. It's not just your spine that suffers. Stomach sleeping can also compress your internal organs, especially your lungs, making it harder for your body to circulate oxygen efficiently. Poor oxygen circulation leads to restless sleep, leaving you feeling groggy and fatigued. The starfish sprawl. Next up is the infamous starfish position, lying on your back with your arms and legs spread wide. While it might seem like a carefree way to sleep, this position is loaded with pitfalls. One of the biggest issues with the starfish position is its impact on breathing. When you sleep on your back with your limbs spread out, your tongue and throat muscles are more likely to relax and block your airway, leading to snoring or even sleep apnea. Sleep apnea is no joke. It's a serious condition that affects over 18 million Americans. It disrupts your sleep cycle, reduces oxygen levels, and increases the risk of heart disease and stroke. If you often wake up feeling like you didn't sleep at all, your starfish position might be to blame. Another problem with this position is the strain it places on your shoulders and hips. Sleeping in a spread-out posture can compress the joints, causing discomfort and stiffness. Over time, this can lead to chronic joint pain and reduced mobility. The science of better sleep. If these positions are so bad, what's the ideal way to sleep? According to sleep experts, side sleeping is the gold standard, particularly on your left side. This position not only promotes proper spinal alignment, but also supports digestion and reduces acid reflux. A study published in the Journal of Clinical Gastroenterology found that sleeping on the left side can decrease acid reflux episodes by up to 75%, making it a great option for those with digestive issues. Side sleeping also improves circulation. When you sleep on your left side, your heart pumps blood more efficiently, and your organs have more room to function without being compressed. If you're a dedicated back sleeper, don't worry, you can still sleep comfortably by making a few adjustments. Place a pillow under your knees to maintain the natural curve of your lower back. This reduces pressure on your spine and helps prevent morning stiffness. Also, keep your arms at your sides to avoid compressing your shoulders. Practical tips for changing your sleeping position. Switching your sleeping position might feel awkward at first, but with a few tweaks, it's entirely doable. Here are some practical tips. Use a supportive pillow. Choose a pillow that keeps your head and neck aligned with your spine. For side sleepers, a thicker pillow works best, while back sleepers benefit from a medium firm pillow. Add extra pillows if you're transitioning to side sleeping. Place a pillow between your knees to reduce strain on your hips and lower back. This small change can make a big difference. Train your body. Use positional aids like body pillows to keep yourself in the desired sleeping position. Over time, your body will adapt and it will feel natural.